Hello, my name is Kaylin Bozeman. I'll be talking about Canada for the Global Presentation Project. First slide, I will be mentioning the population, which is 37,742,154. The yearly change from that was 331,107. And so for the providers, there are about 90,000 or more in Canada today, and the female providers have risen since 2018. And for facilities, about 1,000 facilities in Canada today, and more are being built. This slide, I'll be mentioning Canada's healthcare history. The federal government passed the Medical Care Act in 1966, which offered to reimburse or cost share one half of the provincial and territorial costs for medical services provided by a doctor outside hospitals. Within 6 years, all the provinces and territories had universal physician services insurance plans. Make sure to provide care for the elderly. The population is growing as the years go by. Canada is committed to ensuring that it meets the diverse needs of older Canadians now and in the future. The elderly today have more choices for living, working, retiring, and staying active. This will require further policy action. Slide, I'll be mentioning the healthcare policies. Providers are not government employees, but some are publicly financed. The healthcare system is also publicly funded. It covers for medically necessary healthcare services provided on the basis of need rather than the ability to pay. This slide is about nursing home systems, or in other words, long-term care facilities. In Canada exists under three types: public, subsidized, and private. Public and subsidized differ only in their ownership. All other aspects of funding, admission criteria, and the cost to the individual are all regulated by the provincial governments. Facilities are completely independent from government ownership and funding. They have their own admission criteria. They must maintain certain provincial standards, and they require licensing from the ministry. The strength in Canada's healthcare. One strength is access of healthcare for everyone. Another one is education programs reduce the cost for healthcare. There's more public awareness about health risks, and these programs are funded by the government. Many veterans are looked after in elder years. Canada has excellent primary care for their citizens. And lastly, Canada has an overall B ranking for health performance and quality of life. And now I'm going to mention the weaknesses in Canada's healthcare. The first is because it's universal, it can be a long waste of times, and usually people that have like surgery, they kind of got a certain wait time, so it's like pushed back many of times. Another one is fees don't take into consideration the cost of living. And also, those in rural areas may not get a fair share of the care. The healthcare system itself needs to be more active and outgoing. On this slide, I'm going to be talking about the current system and immigration. Firstly, Canada's universal healthcare system, is a little less universal when it comes to immigrants. Must have been living in Canada for at least 3 months to at least be eligible for Canada's universal health. But new immigrants have limited access to free medical care and will likely have to pay for some treatments or insurance. So overall, it would be hard for an immigrant to get Canada's universal health care. This last slide is about the future and direction and growth of Canada's healthcare. Firstly, the health spending continues to grow and is expected to reach $264 billion. Changes in technology could improve the healthcare system, which would help because many are living longer and experiencing more cases of chronic conditions. Canada needs to have more innovations in order to not fall behind others. More challenges could be ahead for Canada because of the population growth and immigration growth. Overall, Canada has a great healthcare system. They just need to be more innovative with their technology.